I was kind of a rambunctious kid, so I ended up in the ER a few times with needing stitches, and was just impressed with how they were able to just fix people. I grew up in the era of, the original ER and MASH and various, influences, but I always thought I'd be an emergency room doc, and more specifically pediatric emergency. When I rotated through ENT, people were still working in their 60s and 70s and still had a smile on their face. ENT's kind of broken down into ears, nose, and throat, and then head and neck. And so I do a little bit of all of it. The nasal part, we do a lot of sinus work as far as related to sinus infections, breathing problems, obstructed breathing, and then throat-wise, mostly we deal with tonsils, but also throat cancers, swallowing problems, voice problems. I like to diagnose, so figure out what's going wrong, and then inform and educate people on what I think is going wrong, and that way that enables them to kind of decide for themselves if they want to have an intervention, whether it's a medication or a procedure. A lot of what we deal with can be lifestyles, so it's not like you have to do something. You don't have to do anything about, seasonal allergies. You could suffer through and sneeze and blow your nose, but you can also treat it, either treating the symptoms or treating the underlying causes. And so it's kind of that informed, shared decision making. So educating people, helping them know what's wrong, and then giving them insight into how that can be fixed. I would hope that they learn something about the problem that they came to see me for, and that we have a path towards, improving their quality of life or remedying a situation.